Okay. Okay, I've got to wait for the go-ahead. Although I think Victor is just in a power trip. 5, 4, 3, 2. Welcome to True Health Tuesday, and the truth will set you free. Truth is something, you know, we should call what's appropriate for truth nowadays. This is our first live broadcast on the Dr. B VIP site. Now, I'm trying to put some code words up here because they are, I don't know if anyone's heard, they are censoring people. This is brand new. I know. No. This is not the Czech Republic. This is America. Okay, but we're going to get into that. So tonight we're going to talk about the neck, but all the things that are involved in this. And that's going to be the first part. The next part, we're going to talk about Kovac. Okay, that's a nice code word. Hopefully they won't pick it up. But on the Dr. B VIP site, this is the very first show that you're going to be seeing it all the way through. Okay, so this way you don't get any interruptions. It's going to be just like you're here hanging out, except you can't yell at me. Now, when we're looking at this, our first live, this is huge. Anybody that's got this, that's on the Dr. B site, share it. Share the information. You're going to get the PowerPoints. Now, this one, you're only going to see me in a little shot of the slides. We're going to have the PowerPoint and the full-blown edited, so it looks really pretty version, okay, in a week. We're going to have the PowerPoints in PDF form that you can share, that you can get the URLs off of. So this way, if you see information that you want to share, like let's say you get somebody that says, well, no, the government says that the efficacy is 95%, then you know, you can actually share what the CDC think is efficacious, okay? And that way you can solve a lot of the arguments with things called facts. Extreme Health Academy, get in there. I mean, it's amazing. It's only $20 a month, but the information is valuable. Just try it. So let's look at the neck. When you look at this, headaches, 93% of all headaches come from the neck. Okay, that means that if there's a problem with the neck, the muscles start to fire off, and that's where they're coming from. Now, you can think, and you know, I mean, obviously you got toxicities, alcohol, drugs, things like that, but we're looking at less than 0.1% are from tumors. So we have to look at the neck is like super important. What's crazy is that doctors will actually prescribe a chemical knowing that there's a mechanical distortion of the spine 93% of the time. So if you have a reverse curve, now this is in the defense of doctors, you're looking at 2 x-rays there, but it's actually the same person. Okay, do they look different to you? Yes or yes? Obviously. The problem is they look the same to a medical doctor. Now they'll be able to see different shapes on there, but they're not taught that an abnormal structure equals abnormal function. They're not taught that the abnormal structure can cause alterations in proprioception or your brain's awareness of the body in space. Okay, you can obviously see that they're different shapes. Now, when you have a normal curve, you have less distance. When your neck is forward or the curve is straightening, that's called stenosis. It can literally pull on the spinal cord. So assessing it would be important. This is kind of like, it's called intelligence, that your body is intelligent. It gives symptoms for a reason. Oh my gosh. Now obviously you're the normal posture, but you work with that other person. Okay, you've seen it, right? Okay, everybody has. So when you hear people that says, oh, I have a repetitive motion injury. No, they don't. But if you have a repetitive motion injury with a head forward, that can compromise the structures in the neck, leading to a problem. Now, is the body smart or smart? It's smart. So for every 1 inch of forward head carriage, that pressure on the disc double. So when that ear goes 1 inch forward, because it's supposed to be lined up with your shoulder, bam, the muscles fire off. So when that head goes further and further and further forward, you get a tremendous amount of muscle spasms in the neck and mid-back. This is why a lot of people are coming in here with, oh yeah, I got this tightness and stiffness in between the shoulder blades. No kidding. And then you'll get people, oh yeah, doc, you know, my shoulders were all messed up, But now, you know, it still seems a little weak. I said, yeah, you got to fix the friggin' problem. Now, the muscles that run down either side of the spine, there's no conscious control over there. In fact, I had a couple of patients, okay, that I explained to these muscles. I actually touched the middle of the back and I said, go ahead, tighten them up. Go ahead, go ahead. I didn't exactly sound like that, but you know, it was kind of like back in the high school. Okay, and you can't. So what I would tell in you know, as a teacher, I would say, okay, let's say that you got a neck that's all spasm. You got these massive spasms in there. Okay, should you relax those muscles? Relax those muscles and allow, and so the body can accept the adjustment. You know what they would say? Yes, relax them. And I'd say, you'd kill that person unless you know why the muscles are firing. And so then I'd pick somebody with forward head carriage. And I'll say, now, if your head is forward, those muscles are firing off to reposition the head. If you relax those muscles, which way is the head going to fall? Bam, further forward. So you got to find out why the muscles are firing. Why? That's the key. It's detective work. It's called critical thinking, which is completely lacking in most medical circles. Now, the curve in the neck is called the arc of life. Absolutely. That restores the nerve supply and blood supply. Parkinson's, you're going to see 100% of people with Parkinson's with the head forward. Why? Because the spinal cord doesn't stretch. So if that head goes forward, you're literally pulling on the brain stem. The brain doesn't stop at the skull. There's an oblong section that extends the top portion of the neck. Now that's the cardiac and respiratory center. Now, have you ever heard of rotator cuff problems? Golfer's elbow, tennis elbow, carpal tunnel syndrome, ever hear of those things? They're all coming from the neck. They're called double crush injuries. Now, there's a nerve plexus that comes out of the middle bottom part of the neck that supplies the whole arm. And I put the mnemonic that I used to take to tell people, Robert Taylor drinks cold beer, roots, trunks, divisions, cords, branches, okay? 5, 3, 6, 3, many. I can still draw that sucker from memory, okay? Yeah, well, you do something, you know, every week for 8 years, you get better at it. But this also, the dermatomal pattern or the symptom tells you where the symptom is or where the lesion is. See, you've got what's called a dermatome, and it's an area of skin supplied by a specific nerve root. And one of the most brilliant doctors that was one of my teachers, Dr. Jacobson, he said, to find out what's wrong with a patient, you got to do 2 things. 1, ask them, and 2, listen. Friggin' guy was right. Okay, so his patients will come in and they'll say, man, I got this pain radiating right down here. That's the 6th cervical nerve. I know exactly where that's compressed. Or they'll say, it's all in the back of my hand. That's the radial nerve. That's going to be a problem going a little bit away from the nerve root. And again, you'll get patients in here that were told wrong things from the medical professionals. See, muscles don't cross the joints. Muscles are on one side. Tendons will cross the joint. So you can have a joint problem, great. Okay, that could be cartilage, it could be bursitis, it could be tendonitis, there's a lot of things. But you're not going to have a joint problem that radiates down like this. That's impossible. It has to be a nerve compression. So the location of it's hugely important. Now, you've got a chest. Inside the chest is a pump. And you got a small opening up here called the outlet to the thoracic. Now, if that heads forward, you're literally choking off the blood supply that comes out of that and the return. Now, when you think about this, all the joints in your body, they're 2 bones coming together surrounded by a synovial capsule, at least most of them. And that capsule is filled with a superfiltrate of blood called synovial fluid. So if you choke that off, guess what happens? There's desiccation or drying up of the joints. Now, all muscles attach to a bone via a tendon. So muscles don't cross the joints, but the tendons do. I mean, you got the deltoid that does, but you got the tendons that do. Now, around those tendons, because those tendons are crossing a joint, there could be friction that builds up. And so what cushions that is a bursa sac. And what's inside that bursa sac? Say bursa fluid. Okay, bursa fluid. Okay, I know. Duh. Yeah, remember, I'm going slow. There's some medical professionals on here. Okay, so bursa fluid is a superfiltrated blood. So let's say that you're in a stress state. If you're in a stress state, the blood starts to clump together and it doesn't have that same viscosity. Let's say you're dehydrated, it doesn't have the same viscosity. Let's say you got type 2 diabetes, which is a blood poisoning. It's not going to have that same viscosity, so it can't filter out. And this is one of the reasons that you have joint destruction with diabetics, because their blood's not healthy. It can't filter out through. So if you compromise the blood supply, the tendon starts to develop friction, and that's called itis. So that would be tendonitis. Thank you for stealing my thunder. I appreciate that. All that setup, man, pop that balloon. Thank you. Okay, so that tendonitis, but also the bursitis. Now, this is the crazy part. So we know bursitis comes from lack of fluid. Where's that lack of fluid? It could be from forward head carriage, could be muscle imbalance, could be, there's some reason for it. But to put ice on it, does that help blood flow to the joint or decrease it? It decreases it. So you want to put heat on the joint to rush blood to the area. That's absolutely vital. Now let's think of something insane. What if you take a non-steroidal anti-inflammatory, some type of pain reliever for tendonitis? Okay, that destroys the building block of cartilage. Okay, and it's not from Motrin deficiency that you have the joint issue. So restoring the curve of the neck, amazingly important for bursitis and tendonitis. Now, C3, C4, C5 keeps you alive. What does that mean? That means the third, fourth, and fifth cervical, a nerve comes out of there called the phrenic nerve, and this is the diaphragm. So can you imagine if you have good muscular diaphragmatic function, you got good breathing, but you've got the esophagus that pierces that diaphragm. So let's kick it up a notch. That esophagus, the food tube, pierces that diaphragm, and you've got the stomach underneath. So let's say you choke off the nerve supply to the diaphragm. You know, you have some kind of problem, some type of trauma, whiplash, something. Now, is that diaphragm going to be healthy or not that healthy? So it's not going to have good tone, will it? Now, you got the stomach on the underside of that. So what happens is the fundus of that stomach, or the back half of the stomach, can start to pooch up, okay? And then that's called a hiatal hernia. So does that mean that if somebody has a hiatal hernia, they're not suffering from lack of antacids? That, again, remember, I'm just bringing common sense into an insane world, okay? It's not lack of drugs. The body is actually given symptoms for a reason. So does that mean that a cervical trauma, a neck trauma that you could have had back 20 years ago, could that negatively affect the tone of the diaphragm, allowing the fundus of the stomach to come up, causing that reflux, that hiatal hernia? Absolutely. That's why, what do we check on people with asthma, breathing problems, digestive problems? You got to look at the neck. Now, there is a sensor in the neck, and this is amazing. You've got the heart here, okay? You got the carotids coming up. It splits to internal and external. At that split is a sensor for pressure and a sensor for carbon dioxide. So if carbon dioxide levels are high, then the heart rate increases to get the carbon dioxide levels down. If the carbon dioxide levels are down, then the heart rate slows down to get the carbon dioxide levels back up, because carbon dioxide is an acid. Okay, and you need to balance that carbon dioxide to balance your pH, or the acid-base level of your blood. Now, I know what you're thinking. What happens if you wear a mask 24 hours a day? Okay, well, you know, what they found is it does increase carbon dioxide and increases oxidative stress, and you're rebreathing in a bunch of stuff like cells and molds and funguses, and that you're supposed to replace that every 20 minutes or so, or when it gets moist. Isn't done that way. So the sensors in the neck, okay, are vital for blood pressure, heart rate, and physiology. Now, shoulder and rotator cuff problems. You've got a bone called a humerus. This is held in a socket by muscles called rotators. Now, if any of those muscles get weak, it doesn't fall out of the socket, it falls up. That's why from here to here you're strong. When you go like that, that's when it malfunctions. And now the socket that holds it's called a labrum. Now the most commonly torn muscle is the supraspinatus. Why? Because that's right at the top. So if you've had a neck injury, you're going to choke off the blood supply and nerve supply to the topmost muscle. That's the one that's most vulnerable. Now, let's say you've had chronic shoulder problems. Doctor's going to go around, touch you here. Ow, you got tenderness right there. You got tenderness on the supraspinatus. He's going to order an MRI. Now, an MRI, a magnet spins around your body really fast, faces all the hydrogen ions in one direction, and then a computer interprets it. Okay, now we know interpretation might not be exactly accurate. Okay, I'm not talking about the PCR test, but that's, one of them. Okay, so the computer wants to give you a nice picture, so inflammation distorts it. So people all the time will come in here and they'll say, yeah, I got to have that surgery. The supraspinatus is totally torn, or it's only being held on by one thing. Okay, well, let me tell you, this is how you check it. The supraspinatus works the first 15 degrees of motion. After that, the deltoid kicks in. So what I'll do is I'll hold the person's arm here and I'll say push against my hand. If they have strength, then it's still there. I don't know how damaged it is, but I know if they're coming in and they're saying, gee, doc, my shoulders are really messed up, I'll say, I don't think it's the shoulder. We got to reposition something, make sure we restore the blood supply and nerve supply. Does that make sense? And because if the supraspinatus is totally destroyed, what they'll do is they'll throw their hip out to get this beyond the first 15 degrees. So someone with a totally destroyed supraspinatus, I'll say, okay, move your arm out to the side. They'll go like that. And they'll do it without even thinking about it because they've done it to adapt, okay, to that pathology. Now, so you can identify the supraspinatus by applying direct pressure on it. Now, we know that that's going to be like 99% of the time secondary to the neck. Now, when there's a problem with the rotator cuffs, and I know I'm running through all of the cervical stuff at once, because we've got separate videos on carpal tunnel syndrome, separate videos on asthma and breathing problems, separate videos on arthritis, separate videos on all of this stuff. I just want to put it all together in one format, okay? And so you've got, the problem is those muscles are holding this in a socket. If any of those muscles get weak, it doesn't fall out, it falls up. So that means that this bone is shoved up here. So here to here, you're strong as all heck. When you go like that, that's when it malfunctions. And that's called a superior displaced or distorted labrum. Now, this bone is up forward. So what the correction is, you got to correct the neck so you restore the nerve supply and blood supply. Does that make sense? And then you got to get a weight to pull it down and then dangle it. Now, typically, this is a 5-pound weight. This will be good for nobody, okay? Nobody, because you got to have enough weight to drop it down. And I'm talking maybe an 80-pound gymnast, okay? This still wouldn't be enough weight. So you need a significant weight, something a little bit bigger, okay? Now, I just had a patient with partial stroke, lots of trauma, everything else. They could barely grab stuff, and they were trying it with a 1-pound weight. That doesn't work. So I had them keep their arms straight, and I had them just curl their fingers like this with their arms straight, and I put my finger in there and I pulled down, and I held it and just swung it back and forth. So it's just like a pendulum, nice and easy. But you want one going forward, one going back. And that drops it down, and the movement back and forth starts to reform the labrum. Now, what's insane is what a lot of people will do with a shoulder injury is they'll try and stretch it. Well, if you're moving this up on a wall and it's already shoved up, you're going to have more and more and more of a problem. Okay, does that make sense? Are we having technical difficulties? Okay, good. So I'm supposed to totally ignore you coming up. Okay, good. Bummer, it's live. We can't fix that in editing, can we? Okay, now bursitis. 99% of bursitis, you want to put heat on it to rush blood to the area. 99% of bursitis, you want to restore the blood supply or nerve supply. Now this happens to be bursitis in the feet, the knees, the legs, everywhere, except for the electrodon bursitis. So now imagine if you're sitting there, okay? Your elbow is sitting on something. You've got a pad here called the olecranon bursa. Now, do you think that might be damaged if you're sitting on it? What if you fell skateboarding? Yeah, that's why they got elbow pads. So this is a really common area of injury. Now, here's a good test for you. Okay, you've got a sac that surrounds the tendon or muscles or joints to decrease it. It's called a bursa sac. It's filled with bursa fluid, okay, which is a superfiltrate of blood. Now, if that bursa sac is getting bigger and bigger and bigger, is that a problem with blood flowing into it or blood draining from it? Flowing into it, I know, duh, I know. Okay, but I'm saying it crazy like that because obviously it's a friggin' balloon. It's getting bigger and bigger and bigger. So it's not a problem with the blood flowing in it. It's a problem with the valves draining it. So let's look at this common sense wise. You put a brace on it, okay, like an ACE bandage or a neoprene sleeve to create a back pressure. And then you use it. But first, you got to correct the problem with the neck. You got to clean up the blood. So this means soluble fibers, juicing, blending, all of that. Does that make sense? Yeah, and it starts to heal very, very quickly. Carpal tunnel. Now, what I used to do when we were working on cadavers is I'd have a hand, I'd reflect the skin off of it, and just like this picture shows, it's a tunnel. It really is a tunnel. You can actually stick a dime in there in an adult's hand. So it's that big around. Now you got muscles on one side and muscles on the other. These are called flexors because the hand squeezes. These are called extensors because the hand goes out. Now strength ratio, it should be about 5 to 4. Okay, it should be almost the same strength. Problem is nowadays that we're grabbing and everything, computers, everything else. So we're not using the extensors a lot. So typically there's a muscle imbalance. What does that do? That starts to put pressure on the flexors here, and that flattens out the tunnel. It literally flattens out the carpal tunnel. It also moves the ulnar bone in medially, and that's if you're adjusting and you're correcting carpal tunnel syndrome, you're looking at a medial displaced ulnar, one of the bones coming down here. So that's just, you know, for chiropractors, check it out. But what do you do with the pain? Well, first, carpal tunnel is a double crush injury beginning in the neck. You got to restore the neck curve. Oh God, that makes sense. And that restores nerve supply and blood supply. But then you have to use an exercise device. Now, this is a bag of exercise devices. It is a number 32 rubber band. Now, one of my patients happens to be a professional MMA guy. I didn't talk to him this week, so I can't use his name, but he is huge. He's a colossus. Okay, if you're into MMA, you'll know who I'm talking about. Okay, I use this with him. Okay, and it's not just one rubber band, but what you're going to do, we want to work just the extensors. Now, some people will say, well, do the wrist exercise. No, those do not cross the carpal tunnel. You need to use these muscles that operate the finger to put an increased pressure on the superior arch of the carpal tunnel. Okay, so what you do, you put your hand like a flower bud, then make it into a claw. Flower bud to claw. Now, flower bud, that's not a claw, that's waving. Okay, so flower bud to claw, flower bud to claw. And you do this all the time. But now, am I doing it good now or not? Not, because I've got the nerve compressed. So you got to get the curve up, and you do this over and over and over. You do it to fatigue. And then what do you do when you're done? You do it some more. Okay? And if you're over like 40, no one will suspect you to shoot people. That almost made it to you, Victor. Okay, now, what's really big is when you've got that massive pain, and I'm telling you, carpal tunnel, you want to almost amputate your hand. It hurts like the dickens. So you go to sleep, you roll over it, it'll wake you up, everything else. So I have a brace here, and this is electric tape. I know it seems like ridiculously simple, but let me tell you, it doesn't stick to fur. Has anyone ever sealed up a cut with duct tape? No? Okay, yeah, okay, good. I knew there was, we're more brothers than you think. Yeah, it works great. Removing it is not fun. Okay, it's not fun. So what you do, you use standard electric tape, and this is just to function a little bit, but also, remember, what does carpal tunnel come from? It comes from a muscle imbalance. That's a secondary problem to a problem in the neck. How do you make a muscle imbalance worse? You brace it. You stop the movement. You can't do the correction or anything else. So you got all these people walking around like this, deteriorating. And then you got worse problems. This is why 80% of the time, once they do carpal tunnel surgery on one, guess what? They got to do it on the other. And all they're doing is coming in and cutting this band of tissue in here called a flexor retinaculum to decrease the pressure. They're not fixing the problem or the actual cause of the problem at all. So this is how you take the pressure off. You put your thumb and pinky together. And now you see where the wrist bends? Okay, where it stops bending, these bones here are called metacarpals. You don't want to put it on the wrist, you want to put it on the finger bones. Okay, the bottom of the finger bones. It's actually the proximal aspect of the metacarpals. So you put this on there, thumb and pinky together, wrap this around. Yeah, this is like watching grass grow. Okay, and so then you maintain it. You can see how it like pinches my hand there. That's ideal. You got full range of motion. You can go back to typing, but this way here, it will stabilize it. Okay, you're only going to need this for about a month as long as you're seeing somebody that can correct it. And it's not going to damage anything. It's great, and you can throw it away afterwards. Now, if that head's been forward for a long time, the muscles that support the head stop right at the top of the shoulder blades, a little bit lower than that. But also trauma, accidents, everything. I just had a guy that rolled a VW, okay, and literally slammed against the side. And this was 10 years ago. So guess what happened? In the middle of his back area, that's where there was a structural problem. So what happens is when you have that type of problem, you round over. And what that does, that opens up the holes in the back where the nerves are coming around. So when you see someone with rounded over shoulders, they're actually taking pressure off of the nerves. Now this is hugely important because the heart has two nerve supplies. One is the top of the thoracic area, the other is in the cervical spine. This is the parasympathetic, that's the sympathetic. So when you see somebody rounding over like this and the head's going forward, typically they're protecting the heart. So you're going to see loss of curve in the neck. And when you start to see that increased rounding of the shoulders, it's called an increased kyphosis, you're going to know that there's some kind of problem there. There's going to be either a problem with the neck, a problem with the upper thoracic area, and then you could even ask them, say, hey, have you had any heart palpitations at all? You know, you feel that little, then you take a deep breath and it goes away. Yeah, you'll see that if with that body posture, they're going to have it way over half the time. You're looking at 70, 80% of the time. And so this is why it's hard for me to go to big department stores and I'll be seeing this and I'll go, oh my God, that girl's got, you know, no forward head care, this, you know, double chin, the thyroid, just tons of stuff. Now the heart has two nerve supplies. Now the way the heart works, okay, and then again, we're just using common sense in a crazy friggin' world. Okay, the heart has 4 chambers, okay, and it has this pump. Now you've got the bottom of the heart and you've got the top of the heart. The top of the heart is the atrium, bottom is the ventricles. So when the atrium contract, the ventricles have to fill up. When the ventricles contract, the atrium has to fill up. And you can't have them contracting at the same time. So you got the pacemaker of the heart called the SA, or sinoatrial node. That's the pacemaker. Then it goes down to the AV node that slows down the nerve supply so the ventricles can fill up. Then it goes to the bundle of His, Purkinje fibers, and that's how the whole thing works. Now, when we talk about heart health, you see where they actually put a pacemaker, how they work, all this other stuff. But anytime you get cardiac arrhythmias or AFib or any of that, the doctors are looking at that inside of the heart as being a problem. And they'll burn parts of the heart, they'll cut parts of the heart, they'll do all of this stuff, but they're not looking at the sympathetic and parasympathetic nerve supply to the heart. It's mind-blowing. It's so simple to take an x-ray, to see a structural deviation and say, wow, you know, that could be an altered nerve supply to an organ system that's vital, okay? Because think of this, has anyone in here ever had your arm, you know, around somebody that you didn't want to remove it because it was so much fun and it started to go numb? Okay, every guy in here has done that. I know, sir. What's it feel like when it comes back? So it's all like pins and needly. That's because when you compromise a nerve, it gets more sensitive. And so when you have something like this guy on the left, you can see in the top of the rib cage area significant lateral deviation. And of course, this probably happened 20 years earlier. He was about 69 years old. So he was taking 2 high blood pressure medications. Why do you think? Well, for cardiac arrhythmias or high blood pressure, he's stressed. There's some reason for it. Now, when you have a stress state, you've got an adrenal and thyroid that are balancing out. When the adrenals are up, the thyroid's down, so he's got a low-functioning thyroid. Anyone think his thyroid's low-functioning, or do you think he's in a state of adrenal dominance or adrenal fatigue? Obviously, the guy is in a stress state. Now, since he's in a stress state, he's going to have low stomach acid because he's in this fight-or-flight state. And of course, they're given a pain reliever, which is usually a non-steroidal anti-inflammatory, which destroys the building block of cartilage. And people wonder why 60% of Americans have a chronic illness or disease. So let's just fix the problem. Oh, by the way, that's before and after. Okay, you teach someone how to check their blood pressure. All they got to do is deep breathe 10 minutes before. You get them out of the physical, chemical, and emotional stress. You change their structure by doing chiropractic adjustments. You teach them how to sleep and how to clean their blood. And you're looking at within less than a month, their blood pressure is going to start to normalize. I mean, it can't be that simple, but it is. I mean, we've got the Journal of Manipulative and Physiologic Therapeutics. Okay, it turns out that when you adjust these areas, the body becomes in less stress and you have better function. The Journal of Human Hypertension, 2007, turns out if you adjust this bone, it's as effective as 2 drugs. No, you're right. No side effects. You're right. Okay, so it's better than the 2 drugs. Okay? And it turns out that if you drug a stress response, okay, the University of Alabama, without correcting the problem, that means that for each blood pressure drug you put the person on, their risk of stroke increases. The risk of stroke increases. Why is that? Because your arteries are like this, and everybody's blood pressure is this. Okay, if you're standing in front of a group, it's going to be up here. If you read stuff, if you have, a patient just gave me this, a real good friend, okay, gave me this thing. If anybody doesn't know what this is, okay, this is like a scalp massager, and it feels like a puppy is nibbling your neck. I mean, you will literally get goosebumps, okay? So if you're stressed here and you do this, your blood pressure is going to come down because it feels good, okay? So that blood pressure changes all the time. It's going to go up and down. So what is your blood pressure here? It doesn't matter. Because when you take a drug, your body, the drugs work, it lowers blood pressure, but your body needs it up there. So the arteries are going to constrict, just like putting your thumb over a hose. That's why if you take a drug to lower your blood pressure, you get arterial constriction. That's why it increases the risk of stroke. That's why if you take 2 or 3 or 4 blood pressure drugs, make sure you don't take them together. Now, arthritis. The most common type of arthritis is called osteoarthritis. It's also, and arth means joint, itis means inflammation, except osteoarthritis is a non-joint inflammation, joint inflammation. Again, we're looking at a world that made a mistake years ago and hasn't changed it. Okay, it's also called degenerative disc disease. It's also called degenerative joint disease. By me saying that, would you assume it's a disease? No, it's not. Okay, even though it's called that. Welcome, I know. You're thinking, my God, no wonder I want to go back to the Czech Republic. It is crazy here, I'm telling you. Okay, so it's not a disease, it's not from old age. And you'll see the patient on the far right that's got grade 3 arthritis, that's got a reverse curve, destroyed joints down below, and perfectly good joints above. So aren't they the same age? And you get doctors saying, well, it comes from old age, it runs in the family, doesn't run in the family. Trauma might. If you're into martial arts, your kids might be into martial arts. And it's not from drug deficiency, it is solely from trauma, solely from trauma. So if you have a problem that knocks the body out, you got to get that body back. Kirkcaldy and Willis. Okay, elderly joints prove to be just as strong in torsion and compression as younger ones. So when people come in here and they say, Doc, I'm 50. I don't know if you could adjust me. I got shoes that are older than you. Of course, face down. Well, I've got a congenital thing. It's okay. So do I. It's called blonde hair and blue eyes, face down. You know, we all got something. You're going to be fine. Okay, the weird thing is in this country, we think that the body is so stupid that any symptom needs to be covered by a drug. Now, currently, this kind of speech won't be censored. This week. Next week, don't know. I know you can't talk about the V word, okay. But non-steroidal anti-inflammatories, steroids, this is all common. The most common drug in America, the steroids, destroy the building block of cartilage. Think of that. You have pain. I am not going to look at the cause of the pain. I'm not going to appreciate that your body is intelligent, that it's given symptoms for a reason. I'm not going to give you anything to help an inflammatory process like an antioxidant, like vitamin C, vitamin D, or glutathione, any of those things. I'm not going to look at the reason. I'm just going to give you a drug and say, look, for peak performance, take Advil. You'll be out there golfing just fine, sir. Okay, it's mind-blowing when it destroys the joint cartilage. Tylenol, 1 in 3 America takes this acetaminophen. Problem is, it depletes glutathione. This means liver damage and brain damage. 1 in 3 Americans take it. Is this a healthy population or unhealthy population? Dulled emotional response, asthma, toxic epidermal necrosis, blood cancers, all from the most common drug in America. Mind-blowing. Okay, if this isn't good for you, you could get the opioid crisis. This is how you assess a neck. If you see a horrible distorted neck, guess what? You got to take a stress x-ray. Bam, you bend it. If it doesn't bend, it's going to be hard to fix. If it does bend, even if you have congenital anomalies, even if you've had surgeries, even if you have some kind of distortion in the neck, you're going to be able to see how it moves. Does that make sense? Here's before and after. Now this one was taken slightly incorrectly, and this is one thing I want you to look at. The x-ray on the right, you'll see right above the teeth line, this white line there. That's the hard palate. Now the hard palate can move up to 15 to 20 degrees without affecting the curve in the neck. This is about a little bit, it's right on the edge of 23 degrees. So it's starting to increase the curve in the neck. So that was done kind of incorrectly, but it's not enough to take a post x-ray. You know, I can say, look, you know, your forward head caries is probably a little worse than, you know, than what it reads, but you know, this is in the ballpark. Here's another one, and this one's done correctly, where you'll see the hard palates on both are perfectly level. That's ideal. And you know, so you're seeing before and after. And I get comments, I literally will get comments, you can't reverse arthritis, you can't do that. Okay, and I continually go on there and say, look, if you want, you're welcome to come by my office, okay? I won't show you the names of the patients, okay, but I'll show it, and you're welcome to talk to my patients here. This is our standard operating procedure. So let's get the neck curve back. First, you got to make sure that your neck is able to move. So I'd recommend getting assessed by a corrective chiropractor because there's not many other professions out there that will take an x-ray and a stress x-ray. Then you have this brilliant device. I invented this years ago. I call it the TheraCurve. What it is pipe insulation surrounded by a covering that one of our patients make, surrounded by a piece of webbing. Yes, I used to rock climb, okay, back in the 70s and 80s. Okay, it goes around the base of the neck. You know, you can also use a towel for this. It goes around the base of the neck, don't pull out, pull straight down. And you're only going to use about 2 pounds of pressure. You don't want to pull down. Okay, we just want to restore pivot point so you can get the neck curve working. So when you look up, you pull down just with 2 pounds of pressure, and you're looking up, not back. Okay, and this is going to just get this curve back because it's going to start to get those discs to start to hydrate. And that's called, they hydrate through imbibition, which is movement. Now, I actually had a nurse patient come by and said, you know, I've been using this. Okay, does it look like it's hard to do? Trust me, it's hard to teach someone to do this, okay? This sweet gal, and she was just darling, okay? Because most people, when they first see me, they are hurting, and I mean really hurting. And they've been to half a dozen doctors without any results. So when I'm talking to them, they're getting maybe 20, 30% of it. And so she comes up and she's pissed. Okay, I've been doing that exercise and it hurts. And I go, well, let's go. I'm doing it just the way you said. Just like this. And I go, dear, that's not exactly the way I showed you. Yes, it is. You showed it exactly that way. And I go, well, that wasn't my intention. I need to show you a little bit better. Okay. So that's kind of important. But also, let's say you get a teenager or a little kid. They're not going to be doing that. So what you do in little kids, when they have loss of curve in the neck, you're looking at ear infections, you're looking at asthma, breathing problems. So how do you get them to do it? It takes 18 minutes of consistent pressure to have human tissue accept that new position. It's called a plastic elastic deformation curve. What you do is you say, hey, you want to watch some TV? Lay on the table like this, put your elbows here, your chin in your palms like that, and deep breathe. And you got to watch your favorite TV program for 20 minutes. Yes, you got to watch your TV program today. And it's got to be something fun. Why? Because you want them to have joy. And joy, that increases the parasympathetic, so they're going to be able to regenerate tissue. Okay, and this is easy. Kids will do it. When you're adjusting, we have a totally different adjusting technique. Now, the head is actually pretty good at rotating. It can rotate about 80 degrees, about 80 degrees. I think I'm about 75 degrees, but it can turn really, really far. When you're adjusting, some techniques teach, turn the head, lock it, and then pull. Holy moly. When I see that adjustment, it's like, okay, you don't need to turn it more than 10 to 15 degrees. Okay, honestly, goodness, that's it. You contact and you do the adjustment. And you're only using about 2 pounds of pressure. And this is the finger I use. I don't use this one. I use this one. This is the scary one. Okay, that's what you use to change lanes in Southern California. Anti-inflammatories. Inflammation is how the body heals. If you take a chemical anti-inflammatory, like in Motrin, Advil, Aleve, okay, whatever that is, okay, you stop the healing process. If you take antioxidants like vitamin C, fresh fruit, fresh vegetables, all of this stuff, they can deactivate the free radicals and they make inflammation work better. Okay, does that make sense? So that's the synopsis of all the things that can happen with the neck. We've got a ton of videos that are still on there, okay, about shoulder injuries, neck injuries, carpal tunnel syndrome, asthma, breathing problems, arthritis reversal, shoulder exercises, everything. So this is just the synopsis. And now we're going into the censorable information. Okay, the stuff that, okay, I was telling people before, we used to think, okay, back when I was a little kid, okay, President of America is the most powerful man in the world. Ain't true anymore, is it? Nope, and it looks like we may have a change coming up. We might actually not have our national anthem. We might, I think they're wording things to have no he, she, man, woman, something, something. Okay, well, you know, I'll have to relearn English. Of course, I didn't really learn it that well the first time. Are we all set? Almost? Okay. Okay, so Dr. B VIP, this is the first time that you'll see an uninterrupted view, because this next part, yeah? Yep, yep. So sign up for Dr. B VIP, $297 a month, you know, $29